There is a place not far from here, of good harbors and family farms, of spirited town squares and lazy, leafy commons, where towns have prospered for 400 years, where neighbors have been neighbors for generations. We are the descendants of John Winthrop and his Puritans, who believed that to prosper, they must care
for one another, must be knit together in this work as one.
Community has always been important here. That's why we sacrificed and worked together to build hospitals right here in our neighborhoods. Things are changing now. Many of the old neighborhood hospitals are closing, but not these. Instead, these have joined together in a network, in a community of care.
Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on.
A hospital like Addison Gilbert has deep roots in its neighborhood. So do its doctors.
It's part of the community. I've been here so long, as a kid living here, or as a fisherman. I've dealt with most everybody's family in some point. These are all people I know. It means the world to me.
Being a community of care means applying the best research and expertise to the needs of our families and neighbors, like developing a new method to detect lung cancer in its earliest stages.
With lung cancer patients, the vast majority of them, 70 to 80%, had late-stage lung cancer, and my job was really basically helping them to die. So CT lung screening is the most significant advance that I've seen, certainly in my lifetime, in treating this disease. We really wanted to meet with high-risk patients. We wanted to get out into the community to where they are, to talk with them about screenings. We decided to offer this as a community benefit, and that really allowed us to move forward with lung screening 4 years before the rest of the country.
Offering services for free is not the norm in Massachusetts, where we pay far more for healthcare than the rest of the country. These costs drain our communities of resources we need for other essential services.
Just call on me, brother, when you need a hand. We all need somebody to lean on.
We have a responsibility to do everything we possibly can to enhance the health of the people who live in the communities around us. We have a responsibility to do it in a manner that's cost-effective, that's responsible, so that precious public dollars and the resources of our patients and their families can be used for other purposes. We've got a responsibility to be true to our legacy at Lahey, while at the same time constantly reinventing ourselves for the century that lies ahead.
The world may be indifferent to the suffering of a stranger, to the needs of a neighbor. We are not indifferent. Come stand shoulder to shoulder with us as we labor
together, rejoice together, mourn together, make others' conditions our own, always having before our eyes our community in the work.
It won't be long till I'm gonna need somebody to lean on. Call me when you need a friend. When you need a friend, you